Hello, my name is Sophia Sorensen, and today I'm going to be presenting abortion and ethnic studies and how abortion integrates into ethnic studies, as well as how it integrates into the experience of what it's like to be a woman and how it integrates into the experience of many women. To start off with, um, I'm really passionate about abortion and the rights of it. It's interesting to me how abortion relates to ethnic studies as well, how different ethnic groups deal with the challenges of abortion. So, firstly, I am going to touch upon abortion and Native American experiences. So, the article I've chosen touches upon abortion and ethnic and Native American women. It does a deep dive on how there is a lack of research, resources, and access to abortion within Native American communities. The article is titled Reproductive Rights Denied: The Hyde Amendment and Access to Abortion for Native American Women Using Indian Health Services. The Indian Health Services has a lack of resources towards abortion care and access. There is also a lack of research when it comes to abortion rights in Native American women as a whole. They discuss in the beginning how there are restrictions to federal funds for abortion and how it affects the Indian Health Services. They say current data suggests that the majority of Indian Health Service facilities are unequipped to provide abortion under any circumstance. They talk about how there is a high amount of sexual assault in Native American communities as well as unintended pregnancies. This causes a need for abortion care and access. Without it, there's a huge need and gap for abortions. They bring up the Hyde Amendment and its wide-reaching effects towards Native American women. It affects their reproductive rights and causes a public health concern. So that's that for Native American women and the experience of abortion. Now, moving on to abortion and African American experiences. The article I've chosen for this portion is titled Black Women's Lived Experiences of Abortion by Catherine Brown. I chose abortion due to my deep interest in abortion rights and regulations I previously mentioned in my other annotated bibliographies, and as I previously mentioned earlier in this presentation. While the article is shorter, it still provides valuable information about abortion in American and African American women. The study aims to have a deeper understanding of structural racism as well as reproductive injustices. They designed the study using public health critical race praxis as well as reproductive justice. We conducted in-depth semi-structured interviews with self-identified Black women over the age of 18 who have had an abortion. The primary theme that they wanted to make very clear was that having a choice around abortion is a privilege for some and isn't always granted to African American women. Participants discussed domains of experience around abortion. The domains were number 1, community experience and intergenerational wisdom. Number 2 was personal experience and beliefs. Number 3 was the process of accessing abortion. And lastly, number 4 was reflecting on abortion experience and recovery. All those domains are very valuable in abortion and in relation to the abortion rights of African American women, especially community experience as well as intergenerational wisdom within African American communities. Moving on to abortion and Latinx experiences. The article is titled The Clandestine Epidemic: The Practice of Unsafe Abortion in Latin America. This article starts off by stating that in Latin America, induced abortion is found to be the fourth most commonly used abortion method. It's estimated that the number of induced abortions done each year in Latin America are anywhere from 2.7 to 7.4 million. When I heard that number, I thought it was so staggering, and it's incredibly disheartening as well. As a result of restrictive laws, most of these abortions, for the exception of those done in Barbados, Belize, and Cuba, are mostly unsafe as well as illegal. Also, as a result of this, it is one of the leading causes of death amongst women of reproductive age. 1 of every 3 to 5 unsafe abortions leads to hospitalization, resulting in inordinate consumption of scarce and costly health system resources. There has been an increase in contraceptive prevalence as well as restrictive abortion laws. This has not helped decrease clandestine practices. The article also states how its goal is to discuss the epidemic of unsafe abortions and how that might be challenged in some way. The article closes off by providing recommendations. Recommendations are providing safer outpatient treatment, tightening family planning programs to result in improving women's contraceptive use, as well as the access to information they may receive, and lastly, access to safe pregnancy termination procedures. Moving on to abortion and Asian American experiences. The article I have chosen for this is titled "The Role of Community and Culture in Abortion Perceptions, Decisions, and Experiences Among Asian Americans." The article opens up by stating that community as well as culture have a role in stigma, views, and access in relation to abortion. The article also mentioned how there's been no research done till now in terms of documenting the effect of culture and community on Asian American women, as well as their experience in accessing abortion care within America. The article said that its goal is to fill the gaps within the research of this topic, as well as grasp an understanding of how cultural and community views have an effect on medical abortion as well as access of Asian American women. The research methods they used were community-based participatory research approaches. It's also worked in conjunction with experts in public health, practitioners, advocates, as well as community partners to help understand abortion as a whole, to then create a better understanding to the experiences of Asian American women when it relates to abortion. When it comes to seeking abortion care, the participants wanted to have care with providers of color. This was due to past experiences that they had because of judgment and stigma from white providers. As a result of these experiences, the respondents advised them on ways to improve the overall abortion experiences for Asian Americans in the United States. Number one being to be more culturally aware of abortion providers from the community in which they are a part of, because they better understand their needs. Number two is clinics who provide abortion services near or in Asian American communities may be able to speak the local languages. Lastly, the third is tailored mental health resources with culturally aware therapists. Moving on to abortion in Pacific Islander experiences. The article opens up by saying that abortion is increasingly restricted by law in most Pacific Island countries, as well as that it has immensely high implications for the health as well as lives of women from these regions, as well as there is limited research as to how abortion is framed within the Pacific Islands, at least that it is discussed, interpreted, and made meaningful within a public forum. How abortion is framed can have implications for how it is treated in public and political debate and policy, abortion stigmatization, and informed advocacy strategies. We undertook a thematic analysis of 247 articles, opinion pieces, and letters to the editors that covered the topic of abortion in mainstream print media. We found 3 domain framings. They said that abortion was often characterized as an opposition to gender ideology and national identity. Gender and national identity were constructed by numerous commentators that had affiliations to social conservative ideologies and Christian doctrine. Abortion was characterized as the killing of an unborn child. The fetus was primarily in the center of it all as the key component. Additionally, they said that abortion was said to be an unsafe practice in response to teenage pregnancy. Few commentators constructed women who experience unwanted pregnancies and abortions as making decisions about their pregnancies in response to complex gendered and socioeconomic conditions. The article ends off by stating domain framings of abortion as opposed to gender ideals, nationalism, and the killing of the unborn child complicate simplified ideals to choice and advocacy efforts. Focusing on health and broader injustice experienced by women offer alternative framings. To conclude, the first main takeaway for me was that I have such a passion for abortion, and that made the process of researching this topic in relation to ethnic studies very seamless. The second takeaway for me was that it was so interesting to learn about different cultures and how it pertains to abortion as well. The last takeaway was just how much it affects all women across all walks of life. Learning about the different cultures really changed me in terms of the information that I had already known. It further solidified my beliefs that abortion should be available to all women. It supported my ideologies completely. The first question I'd like to ask is, why are we so keen on stripping women of their abortion rights? I'm going to reframe that. When will we ever give women the full scope of rights for abortion? Thank you so much for listening and your time, and have a great rest of your summer, and thank you for an amazing semester as well.